Throughout time and across the world, doctors have always had higher rates of suicide compared with the general population and with other professional groups. Female doctors in particular have higher rates, 2.5 to 4 times the rate by some estimate. The reasons for suicide among doctors, as in the general population, are often related to under or untreated depression, bipolar disorder, or substance abuse. Far back as May 8, 2018, one doctor commits suicide in the US every day, the highest suicide rate of any profession. Using data that I found from Medline and PubMed, the researchers note that mood disorder among healthcare professionals are not restricted to North America. Studies from Finland, Norway, Australia, Singapore, China, and elsewhere have shown an increase in anxiety, depression, and suicidal thoughts among medical students and healthcare professionals.
With these shocking statistics, I'm going to be bringing doctors and medical students and healthcare professionals from all over the world, and I'm going to be asking them questions on mental health, and hopefully we'll be able to come up with solutions and add our own important addition to this conversation. Over to the guest for today.
So, my name is Philip Ila Williams. I'm a medical doctor. I'm presently practicing in the UK, but I previously had practiced in Nigeria. I finished from Nigerian University, Okada. I'm married, and I think that's just about that, really. I'm a specialty doctor in psychiatry in the UK. Yeah, that's basically about it. Yeah.
Question for today: how do you manage your mental health as a doctor?
Well, it's good you're talking about mental health, really, because I think it's something that has now come to fore in recent conversations about how we need to make it a priority. The good part is that the UK has a very structured system where when we have incidents that happen in the hospital, we tend to have these debriefs after the incident, whereby we sit down together, we debrief about what happened, what we could have done better, how we are feeling at the moment, and generally just your thoughts and feelings at that time. And then there's also always an opportunity for you to talk to a psychologist, talk to a clinical psychologist in case you think you want to take some time out so they can just reflect and do other things that is going to help you. So the good part is that when it comes to mental health of medics, the UK takes it very seriously and it's prioritized here. And if at any point in time you think you need some time to do other things that will make you to become medical, to be a bit more relaxed medically and mentally, you can always speak to your clinical director and all that, and they'll be happy to help with that. So I think it's something that is very helpful here.
How about mental health in Nigeria as a doctor? How? Do you think our doctors are protected mentally?
I think Nigeria is unfortunately is just a. To be fair, I think in Nigeria we don't make it a priority in Nigeria, to be honest. I think the way the system is structured is kind of like structured to fall on the shoulder of the last man. So what you really have most times is the structure where the burden begins to drop from the top, and then it lands on the shoulder of the last person, which probably might be the house officer or the medical officer or the registrar. So you find it's just a system where it just shifted bulk, and when it gets to the last person, nobody cares. I think it's part of the reasons why a lot of people were actually leaving at the time, because they also felt like nobody cares about me here. They could just load the work on me and just walk away. And nobody cares whether I'm doing well, whether I have eaten, whether I have done, There was one time I saw a particular hospital that had a doctor on call for like a full month. A full month. Like, how can somebody keep calls for a full month? And they expect the person to be mentally, and I think it's very unfair to the patients too, because we all need time to reflect, to refresh ourselves, to relax, and so that we can be able to sit down in front of patients and manage them clinically. But if you want somebody to be on call for a whole month, how can that person function effectively in front of a patient? So that's what it is. Unfortunately, we don't make it a priority in Nigeria. I hope we get better soon.
If the doctors are unsafe mentally, well, I won't conclude that statement. I would just let it be that way.
You could check, like, lots of suicide that happens, especially amongst doctors and colleagues. You can check and see how the stress really just mounts up. Some of them might be stress of exams. And the exams could be so rigorous, and the fact that it's like almost it's like a way to fight a battle. Everything is just so tense.
Yeah.
Everybody has that mental tenacity, and not everybody's strong enough there,
Well, these are things that I'm going to do. It's not just you. This topic about mental health and doctors is a conversation I want to open on my channel, and interview other doctors as well, not just Nigeria as well, Ghana, Southern Africa, and let's just begin to talk about it, because I always say that as long as our country will remain, there will always be doctors, and as long as there will always be doctors there, of course there will always be sick people, so we'll always need doctors. And whether doctors are transitioning anyways, sometimes somebody's going to find himself practicing in Nigeria, and there's going to be patients. We have uncles, aunties, and old people who may not leave the country, so it's also important that we try as much as possible to help the system in the little way that we can.
Yeah, so please like, share, comment. It's a very important conversation that we're having here, and you need to get involved.
Thank you so much for viewing today. Hopefully you've learned one or two from the medic of today, and please do like, share, subscribe, and in the comment section could you please leave what you've learned today, or what's your addition to the conversation. Share this video. Let's stop this menace that is affecting medics and healthcare professionals of all kinds, and hopefully we'll be able to have a safer place to practice the profession that we love, and we're going to have healthy doctors who will be able to provide us with the basic and amazing health care. Thank you so much. My name remains Dr. Ogwe Edward Bonoyo, and come on, watch the other videos of this series and other videos on my channel, and until next time, or to the next video, see you.